Well, part of good health, of course, is good vision, and our next guest is an expert in keeping everyone's eyes working well. That's Dr. Salib from the Orange County Eye Institute. Welcome back to the show.
Thank you. Thanks for having me.
Good to have you with us today. You know, pretty much any time you visit almost any doctor these days, one of the things they want to do is wrap this black thing around your arm and squeeze this little bulb and check your blood pressure.
Right.
And obviously that's very important to have normal blood pressure. But from an ophthalmologist standpoint, you're concerned about, if you will, high blood pressure, hypertension in the eye.
That's right, yes. Hypertensive eye disease is what we call it. And basically it's high blood pressure in the body affecting the eye. And most of the time it affects the back of the eye called the retina, which is the inner lining of the eye that allows you to see. And you could see on the screen that basically on the left is a normal retina, which is how it normally would look with the disc, which is the white thing, and the blood vessels there. But in high blood pressure, you'll start to have hardening of the arteries and thickening, much as you would in the body, and then you'll start to get hemorrhages, leakages in the back of the eye. You can get optic nerve swelling, even retinal detachments. And with that comes, of course, loss of vision, and it can influence other types of diseases of the eye, such as even macular degeneration, where people with high blood pressure tend to have a higher rate of the wet kind of macular degeneration compared to those that don't. So it's quite a devastating disease if you let that blood pressure progress and is uncontrolled in the eye.
So when the doctor is checking that thing on your arm, it actually also can impact your vision because they're concerned about your cardiovascular system, but obviously your eyes are fed by that system as well. So
Exactly.
we can see how it relates. I guess that the only way to tell if you have high blood pressure is to test for it, is the squeezing on your arm thing.
Right. The blood pressure cuff is very important. So it's imperative that you visit your general doctor and see if you have high blood pressure. And if you do, then you should definitely go to your ophthalmologist to get checked. I have diagnosed a lot of people with high blood pressure, even though they've never had it before, just by looking inside their eye and looking at their retina. In fact, about 30% of the people that have high blood pressure don't even know they have it until they come to the regular doctor and determine that. So it's very important to get regular checkups to see that.
How common is this?
It's extremely common. In fact, about a quarter of the population in this whole country has high blood pressure, about 23%. And as you age, you have a higher percentage or higher risk of having high blood pressure. So that by the time you're about 60, about half the population has high blood pressure. By the time you're 75, about 3/4 of the population have high blood pressure. The scary thing is that once you know you have high blood pressure, only about half the people who have high blood pressure are adequately controlled for it. So, and about 20 to 25% of people who have high blood pressure develop eye disease associated with that. So it's a huge number of people in this country that have these problems.
I guess the common treatment is they start off with exercise and diet control. Salt, I think, is a big factor of what I've heard.
Yes.
So some of those dietary changes, maybe weight loss, exercise, and then there's medication, I guess, if those things aren't as effective as they want them to be. And there's, I guess, a range of medications that they can prescribe as well.
Right. It's a multi kind of faceted approach to treating hypertension or high blood pressure. So as you said, leading a healthy lifestyle, decreasing your salt intake, increasing the amounts of fruits and vegetables you eat, increasing the amounts of foods with, let's say, calcium, magnesium, and potassium, not smoking, losing weight. All those things are very important. And then once you have high blood pressure that affects the eyes, then you might need other treatments. For instance, if you have swelling in the back of the eye, you might need injections or laser treatments into the eye. And in rare cases, you might need some surgeries depending on the complications you might have with that high blood pressure.
So it's obviously important that we see our family doctor on a regular basis as well as our ophthalmologist on a regular basis. And I guess good communication from us as the patient to our doctor and to you as well would be to say, hey, by the way, last time I was in, my blood pressure was elevated, and you would probably already have observed that if it's serious enough. You would have seen that in the eye exam.
Yeah, that's exactly right. We have to really work with the patient and work with the other doctors to just ensure that your overall health is good. Just because we're only examining the eyes doesn't mean we can't remember the rest of the body. So if the patient has high blood pressure, they should let us know, and then I'll be looking for that and looking for any changes in your eye. I'll be looking for it anyways, and as I said, I've diagnosed some people with diabetes, high blood pressure, or other diseases just by looking in your eyes. They're kind of the portal to the rest of your body.
What do they say? The eyes are the window to the soul, but also maybe the windows to the rest of your body for your health concerns as well.
Yes.
Well, it's an important subject, and again, some of the things you need to share with your doctor. I would imagine probably if somebody is taking medication, for example, for high blood pressure, you probably want to know what medications they're taking, because some of those could be interacting with some things you want to do with the eye as well.
Sure. Anytime a patient comes into our office, we ask about all of their medications in general. Some medications have some effects on the eyes, and we like to know just their general overall history. So certainly, systemic medications can have effects on the eyes that people might not realize, but we definitely look for that.
Some doctors I know that we've had on have said that there are vitamins you can take that assist in your eye. Is that something that you sometimes suggest?
There are certain vitamins that are helpful, especially with people who have moderate macular degeneration. That's the most commonly prescribed reason, the reason that we would prescribe a vitamin. It hasn't really been proven to be helpful in other people, for instance, mild macular degeneration or just people who have no eye problems. But I always think that once we develop the technology to find out if it does help, we'll eventually find out that these vitamins do help. So I often will prescribe it even for people with mild degeneration.
Right. Again, good communication, whether it's your family doctor or your ophthalmologist, that's always very important. Well, speaking of good communication, I understand that you're willing to come and communicate to our over 200 clubs here in the community. If they're looking for a guest speaker, you'd be interested in speaking to them at no charge?
Yes, that's quite right. I'm very happy to come by and speak to your group, to just educate anyone about eye disease, and be happy to answer any questions you might have. I'm always willing to do that.
That's great. Well, if you want to find out more information, we've got the doctor's phone number there on your screen. You can give them a call at 770-1322, the Orange County Eye Institute. And as we say, Dr. Salib, interested in maybe coming to your club or your group and sharing some of this important information with you. Thanks for joining us today. We'll see you back in a few weeks.
Thank you.
Good to have you on the program today. Dr. George Salib, again, that's the Orange County Eye Institute. And if you want to find out more, give them a call, 770-1322. We'll continue on with more of what's happening around your busy community after